Hello, my name is Samantha Pickrell, and I will be presenting on the practice guidelines on dog and cat bites by the American Academy of Family Physicians. Animal bites account for 1% of emergency department visits in the U.S. annually. The healthcare costs associated with these bites are around $53.9 million. Most animal bites occur in children and are caused by dogs, usually known to the victim. Animal bites pose a risk for infection, tendon or bone injury, rabies exposure, and tetanus exposure. The objectives for this presentation are as follows: to review the guidelines on the treatment of dog and cat bites according to the American Academy of Family Physicians. This will be done by gaining an understanding of the strength of evidence of the guideline recommendations, by understanding the purpose of the guidelines, understanding the diagnostic criteria, the recommended diagnostic testing, management recommendations, and by differentiating the current guidelines from previous guidelines and recommendations from other organizations. This guideline is on dog and cat bites and is published by the American Academy of Family Physicians, or AAFB. It was written by Robert Ellis, MD, and Carrie Ellis, DVM, MS, published in 2014. This guideline uses the SORT rating system and rates the strength of evidence of its clinical recommendations as a B and C. The B evidence rating is awarded to recommendations regarding wound closure and antibiotic prophylaxis, and the C evidence rating is awarded to the recommendations regarding pre- and post-exposure rabies prophylaxis. A B evidence rating is given when the basis for recommendation is inconsistent or from limited quality patient-oriented evidence, and a C evidence rating is given when the basis for recommendation is from consensus, disease-oriented evidence, typically from usual practice, expert opinion, or case series. Definition of disease state. A dog bite is a bite inflicted by a dog, causing a break in the skin with the capability of causing a crush injury with damage to bones, vessels, tendons, muscles, and nerves. A cat bite is a bite inflicted by a cat, causing a break in the skin, typically causing puncture wounds and lacerations. 50% of dog bites are self-reported as unprovoked, while almost all cat bites are self-reported as provoked. The purpose of this guideline is to provide information on the treatment of dog and cat bites in the following areas: wound treatment, wound closure, antibiotic prophylaxis, rabies prophylaxis, tetanus prophylaxis, and laws and regulations. Diagnostic criteria for dog or cat bites includes a history from the patient to determine the animal that has caused the bite, whether that animal may or may not be rabid, and the patient's risk in developing an infection. A thorough skin examination should also be performed to determine whether an animal bite has occurred and how extensive the injuries are. Recommended diagnostic testing. Radiography, such as an X-ray, may be indicated if a foreign body or bone involvement is suspected. A thorough tendon examination should be performed, observing the tendons throughout the joint's full extension and flexion to determine if there is any injury. A wound culture is generally not indicated in dog or cat bites unless the wound is already infected or abscessed. Animals should be monitored for 10 days for signs of rabies. These signs include inappetence or decreased appetite, dysphagia, abnormal behavior, ataxia, paralysis, altered vocalization, and seizures. No further diagnostic testing is warranted for a dog or cat bite according to this guideline. Evidence ratings were not included in recommended diagnostic testing for dog or cat bites. Management recommendations are as follows. Wound treatment. The wound should be cleansed and irrigated with water, normal saline, or a dilute povidone iodine solution. A large syringe should be used to debride the wound with the solution to decrease the potential for infection. Wound closure. Bite wounds may be closed if cosmetically desirable. However, wounds at high risk of infection should be left open to close by secondary intention. This is evidence rating B found through randomized controlled trials. Antibiotic prophylaxis. A Cochrane review of 9 trials showed no statistical difference in infection rate between prophylaxis and no treatment, except in bite wounds of the hand. In hand wounds, antibiotic prophylaxis reduced the rate of infection from 28% to 2%. Therefore, antibiotics should be used for high-risk bite wounds and considered for average-risk wounds. This is evidence rating B found through meta-analysis. Wounds at high risk of infection include all cat bites, bites in extremities with underlying venous or lymphatic compromise, bites involving the hand, near or in a prosthetic joint, crush injuries, puncture wounds, victims with diabetes mellitus or immunosuppression, and those with delayed presentation, greater than 6 to 12 hours on the arm or leg, and greater than 12 to 24 hours on the face. Augmentin is generally considered first-line prophylactic treatment for animal bites, and a 3 to 7 day course of antibiotics is likely adequate. Here is a list of the prophylactic antibiotic options and their dosages for animal bites in adults, children, and in pregnant women allergic to penicillin. Management recommendations continued. Post-exposure rabies prophylaxis should be given to all persons possibly exposed to rabies. This is evidence rating C based on evidence-based guidelines. This includes immune globulin at presentation and rabies vaccinations on days 0, 3, 7, and 14. The immune globulin is infiltrated around the bite wound, and any additional volume is administered at a site distant to the vaccine site, usually the opposite arm as the rabies vaccine. Post-exposure prophylaxis is generally not needed in patients with a dog or cat bite as long as the animal is not showing signs of rabies. Pre-exposure rabies prophylaxis should be considered for persons at higher risk of rabies exposure, and for international travelers to at-risk areas who are unlikely to get post-exposure prophylaxis within 24 hours of a possible rabies exposure. This is also evidence rating C based on evidence-based guidelines. Tetanus prophylaxis. Tetanus vaccination is recommended if it has been more than 5 years since immunization. Laws and regulations. Most areas in the United States require healthcare professionals to report dog bites and many other animal bites. Providers should be familiar with their state and local laws. The American Academy of Family Physicians came out with a guideline in 2001 on the prevention and treatment of dog bites. They then came out with another version of the guideline in 2014, which included both dog and cat bites. Both guidelines are very similar, and there are not many differences between the two. The biggest difference is the inclusion of cat bites into the new guideline. One difference is that in the 2001 guideline, they recommend irrigating the wounds with normal saline or lactated ringer. In the updated 2014 guideline, they recommend irrigating with sterile water, normal saline, or a povidone iodine solution. The fifth dose of the rabies vaccine used to be given on day 28 according to the previous guideline. In 2009, the Advisory Committee on Immunization Practices recommended dropping this step. The 2014 guideline only recommends 4 doses on days 0, 3, 7, and 14, excluding the 28-day vaccine. The 2001 guidelines discusses follow-up and wound reevaluation in 24 to 48 hours, especially with bite wounds to the hands. The 2014 guidelines do not discuss follow-up or wound reevaluation. In the original guidelines in 2001, the author does not discuss the laws and regulations regarding reporting dog bites. However, the 2014 guidelines discusses that most areas require healthcare professionals to report dog and other animal bites. Similar to the American Academy of Family Physicians, the World Health Organization recommends early medical management of dog and cat bites, including wound irrigation and cleansing. They recommend the use of prophylactic antibiotics for high-risk wounds and for people with immune deficiency to reduce the risk of infection. This organization also recommends tetanus vaccines for individuals without adequate vaccination and rabies post-exposure treatment depending on the animal's vaccination status. The American Academy of Family Physicians published a guideline regarding the treatment of dog and cat bites in 2014. According to this guideline, animal bite wounds are considered contaminated and need to be irrigated and carefully examined through tendon inspection and radiography. Wound closure is determined based on wound location and risk of infection. Antibiotic prophylaxis should be considered for average-risk wounds and used in high-risk bite wounds, with Augmentin being first line. Tetanus vaccines should be considered, as well as rabies vaccines as warranted.